is Susan Campbell and I'm a registered veterinary nurse. I offer a nutrition consult service for dogs and cats in the United Kingdom, and I would like to introduce you to Bailey. Bailey is a 6-year-old male neutered crossbreed. The first thing we want to do when our patients are in our consult room is gain an accurate weight. This is what we base all of their drug calculations and their nutrition calculations on. Bailey is demonstrating leaning against the wall, one paw off and one nose off. So we want to make sure platform scales, our patients are in the center. If we have small dogs or cats, we want to use the pediatric or cat scales to get a much more accurate body weight. We want to look at Bailey's body condition score. So we want to view Bailey from the side and we want to view Bailey from the top down. We also want to lay our hands on him. So with every physical exam, it's all about what we're feeling as well as what we're seeing. And that way we come to a conclusion with the client as well about his body condition score. During that physical exam, we'll also be taking a nutrition history from the client, especially what types of foods Bailey prefers: dry food, wet food, treats, dental chews, supplements, and any foods the clients have to use each day to give Bailey any medication. We also want to have a look through of Bailey's medical history and see if there's any concurrent diseases that might warrant a different nutritional plan for his weight loss. Then we want to go ahead and calculate Bailey's feeding plan. And we can use some technology to help us with that. So on the Purina website, there is a section called their Vet Centre, where you can create yourself an account and get yourself into this personalised nutrition programme. First part here we fill in is between dog or cat. You can put in the exact breed, or like Bailey, you can choose between small, medium and large mixed breed. You then want to put in their age, and Bailey was 6 years old at the start of his journey. He is male, he has been neutered. He was 25 kilos at the start of his weight loss journey. And then we want to change away from this ideal weight and body condition score to what he actually is when he was presented. So he was actually a body condition score 7 out of 9. This then calculates that he is 20% overweight and that his ideal body weight to get him back to a body condition score 5 out of 9 is just under 21 kilos. We then check this box and that helps us produce a monitoring chart. There's a few other bits down here where you can change the physical activity and environment in which Bailey lives, and that way it will adjust his daily calorie intake. And if you put any other clinical diagnoses or needs, then it will give you the correct foods from the Purina Pro Plan range that are suitable for Bailey. Then we have his daily calorie allowance up here. Then we can personalize this plan by adding in a few details of Bailey. You can put his surname in as well if you prefer, and any clinic ID number that you would like. Bailey was lucky enough to have 3 meals per day. We can adjust that as well here. Then you choose from the dry foods, the wet foods, and the supplements that are suitable for Bailey. Bailey loved a dry biscuit, but only for treats. He did prefer his main meals to be wet food, so we're going to select the Purina Pro Plan Obesity Management cans. Down here, if you pick a dry food and a wet food, you can then adjust the proportions up or down to get the right mix that Bailey prefers each day. If you have any special notes that you want the clients to know about, you can enter it here and make it truly bespoke. And this will then appear on your final program that appears. So this generates. And here we have a lovely document that you can either print out and give to your client, or you can download it and email it to them, or you can upload it onto your practice management system. So it has some details about Bailey, the date that he came in to see us. It's all very client-friendly language, but also on here are all of the calculations. So his current body weight and body condition score, his ideal body weight. It tells you how many calories he needs to have each day to achieve healthy weight loss. It tells you the minimum weight loss we would expect Bailey to lose each week. It tells you the maximum weight loss that we would expect Bailey to lose each week. And in between those two numbers is his ideal weight loss per week. This means no matter how frequently he comes in to see you, you'll then know if he's losing weight in a healthy way. It also calculates Bailey's treat allowance, so 10% of his daily calorie intake can be in treats, and this 10% gives you it in calories. You can then go through what his favourite treats are and decide which ones are suitable for Bailey. There is a pack shot of the products that you've chosen so that the client can then go down to your waiting room and choose the right product off your shelf, or they can choose to shop online and they know exactly which product it is that they're looking for. There's also a reminder here of the body condition scoring chart, 1 to 9 scale. Any personal notes that you put in here for your client, you can add, they will appear here that you've put in. And then this graph. So the red line will give you the, if he loses 2% per week is the red line. The grey line gives you the 0.5% per week, and then there's a space in the centre for you to plot exactly what Bailey loses each week. And hopefully it will be in between these two lines, and that will then help you to adjust his feeding plans up or down, or change any other home management plan to achieve that healthy weight loss. Then down here it gives you a few ideas for his revisit schedule and how we will be reducing the number of calories every month that he comes in, provided that his weight loss is within the schedule. And then you can recalculate going forward from there. Then we want to do the food transition. We always advise clients to do this over a slow period of time so that Bailey's microbiome can adjust to the change in food without any gastrointestinal upset. So a phone call or a video consult in 1 to 2 weeks is great, just to check in with the client, make sure the transition is going well. And then revisits every 2 to 4 weeks to monitor Bailey's weight loss progress and also to recalculate his feeding plan on a monthly basis.